And we've been sharing these stories with you all week last week. The documentary airs later this evening. Now, there's an upward trend in road traffic fatalities with a rise from 1,823 in 2017 to 2,589 last year. In fact, an average of 318 persons die every year between 6 to 8 p.m. as a result of road accident. This is about 16% of the total number of fatalities recorded every year, and it's higher than the number of deaths recorded in any 2-hour period with respect to road traffic fatalities. Now, there's a chart that we will show to you in a little bit with regards to the kind of numbers that we record hourly, and these are human lives that are taken every day on our roads. A documentary titled Crash airs this evening. Now, ahead of that, we want to have a conversation. My guest, Dr. Frederick Kwarteng, is head of Accident Emergency and Orthopedic Center at the Korle Bu Teaching Hospital. He will join us with his thought and experience. Also, Parliament's Roads and Transport Committee Chairperson, Kennedy Nyako Osei. He's also a member of Parliament for Akim Swedru constituency in the Eastern Region, is with us, as well as Member of Parliament for Adaklu. He is ranking member on the Transport Committee of Parliament. Mr. Kwame Agboja is also with us on this issue. Gentlemen, I want to say good morning and thank you so much for your time.
Good morning.
Good morning.
Mr. Agboja, can you unmute so we can hear you, if you can hear me, sir?
Yes, I can hear you. Can you hear me?
Great. Well, good morning to you both. Thank you so much for making time to speak on this very important subject. You're in Parliament, so just your initial thoughts. What do you make of all these statistics representing human lives that we lose every year, and the fact that you could do something about it because you make laws? And I'll start with you, Mr. Chairman.
Well, good morning, and I just want to say thank you for having me on your show. Well, I think road safety issues have become very critical, and as a country, we have to do everything possible to make sure that we minimize the carnage on our road. As Parliament, we, like you rightly said, we make the laws. If you look at earlier on, you see the mandate that was given to the Road Safety Commission. I mean, they were not having enough teeth to bite, okay? So their mandate was very limited, and they didn't have the powers to even sanction the road standard, road safety standards in the country. They were just to, let's say, promote. But this government, since it took over, realized that if we want to take road safety issues seriously in the country, then we have to enhance the powers of, let's say, the mandate of the Road Safety Commission. And by doing so, it means we have to, let's say, repeal or let's say amend the laws and give them extra powers, extra mandate, enhance their mandate so that they become an authority who have powers to even sanction people that will flout. So that's how come we're able to pass the new National Road Safety Act, the Act 993, which now has expanded the scope and the mandate of the Road Safety Authority to allow them to, let's say, come out with more programs, policies, regulate them, and sanction people who would go against this law. So I think for we Parliament, we have done our bit. We expect the Road Safety Commission to also, as the implementers of the law that we have passed, to also ensure that they enforce those laws. But, after the law was passed and was assented to somewhere, they were supposed to bring an LI, a legislative instrument, which, covers the regulation, the actual regulations of for the implementation of the act. It has not come yet because they have to do a lot of consultation, stakeholder consultation. We are talking about road safety matters, and it covers a lot of, because you see a lot of people, virtually everybody uses the road, if not pedestrian or maybe a driver plying the route and all those things. So you need to do a lot of extensive stakeholder consultation to be able to, we have been able to, the last time that I checked, I've realized that they've been able to put all the regulations together. They were bringing it to Parliament, but they have to, because Parliament was rising so early, they are going to bring it as soon as we go back. So I think on our part, we are doing all our best to ensure that we are able to assist the road safety, National Road Safety Authority to also execute their mandate.
The honourable member has actually packed. So if you're just watching and you see that he's in a seatbelt and he's sitting in the vehicle, the vehicle is not a moving vehicle. He's packed and he's having this conversation with us. Just so we clear that.
I've packed. I've packed.
Yes, sure, I know that. Mr. Kwame Agbodza, have you truly done enough? Have you committed to this fight as members of Parliament with the opportunity to make laws that could help? Please unmute so we can hear you, sir.
Thank you very much, Amamavi. First of all, I want to thank Kwame and the team that put this documentary together, and also to thank your network for constantly drawing the attention of the country to this issue. Have we done our best as a country? No, I disagree with my chairman that we have done our best. What we did actually was to, just as the whole country gets traumatized when we see these horrific accidents happen, we've been asking for ways we can review this. And what we have done effectively is to review the legislation that established the National Road Safety Commission then, and to make them an authority, with the hope that we can give them more leverage to be able to deal with this. Largely what they do is education and helping with the MTTD for enforcement. Yes, we did the act. I agree with my chairman when he says that we are supposed to, the National Road Safety Authority is to come to Parliament with the legislation in terms of allies to be able to operationalize specific parts of this law. But Mamavi, it doesn't need the ally for us to resource the National Road Safety Authority as it is now to operationalize issues of education and other things. And why? Because government is failing to provide adequate resources in terms of money for them to recruit the requisite number of people, and also to establish the offices that they said we're going to establish in all districts. So if they are unable to do their work right now, it cannot entirely be the issue of, waiting for the legislation. It's simply because government is failing to fund them. You heard me in Parliament when government wanted to impose new taxes by putting additional taxes on petroleum products. I argued that you're taking money from drivers. One of the best ways you can use this is to use it in ways that can reduce carnage on our road. So use 5% of that money and support National Road Safety Authority so that they can do this where the government threw it out. So no matter what the law says, if government is unable to support National Road Safety Authority to do the recruitment of the requisite number of people, retrain their own people, and have the ability to establish the offices across the country to carry out education, we are not going to be able to do this. In that sense, Parliament have done their part, but the government has woefully failed to carry out their part.
Stay with me, gentlemen. Let me bring into this conversation a man who witnesses... Honorable, I'll come to you. Let me just get my other guests to share some few thoughts. Dr. Frederick Kwarteng heads the Accident Emergency Orthopedic Department at the Korle Bu Teaching Hospital. It's actually one of the leading centers that provides care to accident cases here in our country, and sometimes West Africa. So I want to welcome you, Doc, to this conversation. Thank you for your time, if you can hear me.
Yes, I can hear you.
Okay, great. I am so grateful. Can you share some of the experiences? You receive patients on a daily basis. So how bad is this situation that we're talking about?
Yes, thank you very much. And I hope you can hear me.
Yes, sir, I can hear you.
Yes. As you rightly said, it is the biggest referral center when it comes to trauma, orthopedic, and accident cases. We receive an average of 10 accident victims, especially those needing admissions on the day. In every day, we have an average of 10, and in most cases, we have about 3-4 of them being Okada injuries, and then the remaining 60 vehicle accidents. And a significant number of them are bad injuries, very serious ones that may have to be in the hospital for about 3 or 4 weeks. And in some cases, especially the Okada injuries, the injuries are that bad that to save the patient's life, we may have to actually even amputate their limbs, because sometimes they come in with limbs that have been beyond service. You see, the cases are of various types. You have some that are brought in with head injuries, some that are brought in with multiple injuries, a number of them have broken limbs. And we have a fairly good system in place that takes care of them with a significant amount of success. But it is a big source of worry, the number of cases that we see on a daily basis at the Konebuti Hospital. And so, especially for the Okada injuries, we continue to advocate that the law enforcement agencies strengthen their supervision on the road.
Dr. Kwarteng, well, thankfully, I have 2 members of parliament who are on the transport committee with us on this conversation. So just stay with me a while longer. I want to do some follow-ups in terms of recoveries. Hello, Doc?
Yes.
Okay, Doc.
Yes, can you hear me?
I can hear you. Just continue to stay with me, sir. And I want to go to the chairman of the transport committee, because I know that after Mr. Kwame Agbodza spoke, you wanted to say something, Mr. Nyakose.
I just wanted to respond to 2 issues that my colleague has raised. With regard to the regulation, he's aware. I mean, when you enact a law, it is a regulation that gives you details, the operational details as how to carry out the very law that you have passed. So, yes, the law has been enacted, we pass it, but the regulation that is going to give you details is yet to be laid in Parliament. So when you say that it's because it doesn't matter, I'm surprised that my colleague is making that assessment, and that has been so I just want to correct the impression that he just created. He also raised an issue in relation to funding. Yes, I agree with him that National Road Safety Authority need more resources, but he can also attest that it's under this government that National Road Safety Authority have been given enough, have been resourced enough. They are running one of the most successful campaign, road safety campaign, that is the Arrive Alive campaign. I mean, if they don't have money, how are they doing it? It is government that are giving that kind of money, but we all agree that the money is not enough. They were commissioned. Now they are an authority. We have expanded their scope or their mandate. So it means we need to give them more resources. Yes, we have made an appeal, or we've made a recommendation when we're doing our budget that government should look at it, and if we can even take 5 pesos out of that 30 pesos petroleum tax that is, they have introduced, and give it to the road because if you take that money and we give it to the road safety will now have some enough resources to be able to execute what they have fine program that they want to introduce. Okay, and road safety will not also they work with other agencies like the MMTD. They have to even resource the police. Now they have to even use technology in let's say providing road safety standards or activities on our roads and all those things. But if they don't have the money, it becomes so difficult. So I agree with my ranking when he talks about government should make adequate resources for yes, but he should also admit that it's under this government that we've been able to resource the authority so much that they have been able to successfully run of the most successful road safety campaign as we speak now, but it is not enough. There's more room for improvement, and I think I will agree with him. We can go on. And he also mentioned of having offices across the country. Yes, it's good because once you have become an authority, we need to have offices in the other regions. Which with my discussion with the head of the road safety authority, they are on it to recruit and set up offices across the various regions. Where they don't have offices, to be able to ensure that they are able to enforce those laws that they are. The enforcement is the most important thing here now. The enforcement. The key word is the enforcement. How they are going to enforce and punish people who flout those. And I'm happy if you look at the new act. There are so many. We have given them so many powers to be able to bite. And I think we need to support the National Road Safety Authority to be able to execute all their plans and mandates. So I think that is the reaction that I'll make for now. If there are other opportunity that I can speak to, I'll do a follow-up on that too.
Great. Hang in there for me. I know that Mr. Agboja, you would want to come in, but I want to get Dr. Kwarteng's thought, and I want to wrap up with him so he can leave us and we can have the rest of the conversation. Dr. Kwarteng, you've painted a picture of how you receive these accident cases in your department. Yes. Can you share with us how they recover and how they eventually leave your center? Do they all leave?
Yes. About 90% of them leave the center having received good treatment. Even though of them have various degrees of incapacitation occasioned by the accident. The department has put in place a good system to take good care of them. And we have good surgeons also to manage these cases. The truth is that a number of them come in with very bad injuries. As I said, some of them come in with multiple injuries. They've badly fractured every part of the body. And that calls for a lot of resources. It will also interest you to know that a number of them have economic challenges. They consume most of their finances on clinical care, buying drugs, conducting all sorts of investigations.
So, Dr. Kwarteng, I have two members of parliament with us. They've been talking about the law as it exists.
But by and large, we have a good success rate.
Hello, Dr. Kwarteng. Hello, Dr. Kwarteng.
Yes, my dear.
Okay. Dr. Kwarteng, I was just going to say, what would you say to the lawmakers? I have two of them with us. They are really important because they sit on the transport committee. From where you sit...
Yes. I've always been saying that a greater portion of road traffic accidents are products of recklessness, especially those who drive the motorcycle. That a lot of them, there are laws that have been enacted, but it is the enforcement. See, the enforcement of these laws by the security agencies, that is what will bring down a number of these motor vehicle accidents. And I will request that the police in particular should strengthen their supervision over the motorcycles who ply the streets and the roads of Accra for commercial purposes. And then also on the highways, there should be mechanisms to enforce drivers who drive strictly according to the road safety rules, because a number of them are products of recklessness. And that will be my request for now.
Okay. Just before you go, though, the 10 cases that you receive every day, are you able to adequately deal with them? Are these too many cases for you to handle as a center?
No, we have enough manpower to contain all these cases, and as much as possible, each of them is given good care. Just that sometimes we are overwhelmed, and then sometimes the number outstrips the number of players that we have. But by and large, each of them is given good care. And I must say that a lot of congratulations need to go to the staff at both the emergency and the orthopedic department, because we put in place a system that provides good care for each of the patients.
But in those few cases, when you don't have enough beds, what happens?
As much as possible, we try not to turn away any accident victim. Even if there are no beds, as much as possible, all accident victims are given care. It is true that sometimes, by the time the patients are brought, the emergency might be full, but we don't turn them away. We try and create beds where there are no beds for them. So what I'm trying to tell you is there are cases in situations where we are overwhelmed by the numbers, but in all such cases, we are able to contain them.
Dr. Frederick Kwarteng, we will leave it here and have more conversations after we air this latest documentary, Crash. But I'm very grateful that you could join us. And congratulations to yourself and your team for a good job. Under the circumstances, you worked really hard. I'm grateful to you. Mr. Kwame Agbodza, Dr. Kwarteng has raised a very important issue with the motorbikes and enforcement. But I also want to ask you, with the statistics that we're hearing, would you say that we've gotten to this point where the issue of accident has become a public emergency?
Well, Mamavi, as a matter of fact, the carnage on our roads takes a toll on.
Okay, so I see that our conversation has just been a little bit disrupted. Hopefully, Mr. Kwame Agbodza will be able to
across
rejoin.
The country, including those in Adaklu who will be working hard to save.
Hello, Mr. Agbodza.
Save lives today, and who have always been doing that. May God.
Okay, unfortunately, I think we're having some disruptions. We're going to correct that and raise him back. Seth Kwame Boateng is the producer of this documentary. He also joins us. Seth Kwame Boateng, good morning. Can you hear me?
Yes, Mamavi, I can hear you.
Okay, great. So you've brought back, in fact, we've been talking about road safety for the past year, but we're crowning it at this period with Crashed. And so thank you for, giving us something that brings home the issue that we're talking about. When people look at the visuals that we put out, people can't believe it. It's unbelievable. When you speak to some of the persons who've been punished at this, because they've been involved in road accidents through one careless act or the other, people are now beginning to appreciate the heaviness of this matter that we're talking about. What are you hoping that we'll be able to achieve after this documentary is aired later this evening?
Thanks, Mavi. So as the producer of this documentary, I can tell you that it has really, really changed my style of driving. I'm telling you. Now I'm more careful. Now, where I have to do 50 kilometers per hour, I obey. Where I have to do 30, I obey. Because you may be careful, but the other person may not be so careful and will put you in trouble. Most of the accidents, that's how they happened. So I'm hoping that these images will appeal to the conscience of Ghanaians, especially drivers, so that when they are on the road, they'll be careful. These images would also inform our policymakers how serious the situation has become, and how, from my point of view, it must be declared as a public health crisis, as a national security emergency, so that all the interventions that could be activated, or all the interventions that go with emergency situations would be activated and the problem dealt with. Because last night I was telling somebody the 771 lives that we have lost in the first quarter of this month, when they were leaving home, they told their families, see you this evening, hoping they will come back. They didn't come back. If you look at the figures, we are losing approximately 8.5 lives every day. Let's round this off. It's like we are losing 9 lives every day. So you are not safe, I'm not safe. You left home, you told your children, see you this evening. How sure are you that you're going to go home tonight? That's why we must all be concerned. Yesterday, at Suhum, some people were coming from Kumasi to Accra. They got Suhum, they got crushed. 5 of them died. 5 of them. They told their families, I will see you. They didn't get to them. So I want all of us to have the conversation, to sit down and really think through that these are preventable accidents. We can prevent. So why are we not doing that? Enforcement. Can our authorities see this documentary and activate all the enforcement measures that must be put in place? Not must be put in place, they're already there. But can they really resource the people, our security personnel, to work? Get them to be on the street and save lives. Can we use our conscience when we're on the roads? That's what I really want Ghanaians to take from this documentary.
Closely be watching it. Let me come back to you, Mr. Agboja, and hopefully the connection is better this time around. I had asked if this situation had gotten to a public health emergency status, and you're trying to answer that. We didn't quite get you. Kindly unmute for me, sir. Okay, it looks like our network has become a public health emergency as well, and that connection is gone. Mr. Nyakwose, if you can hear me, if you're still with me, can you address this matter of, we've seen legislation, we've seen executive instruments come up rather very quickly to deal with COVID-19. Why haven't we seen that same efforts? If it is resources that we talk about, if it's enforcement that we talk about, why haven't we seen the same kind of force being pushed behind this one that has claimed a lot more lives than COVID-19?
Maybe I would disagree with you that it has not been issues of national road safety have not been prioritized. If it hasn't, this government wouldn't have gone further to, let's say, enhance the mandate or come in with a new act which gives more power to the National Road Safety Authority to be able to carry out their duty. So that is one. Yes, I agree with you that it has become a national emergency, public health emergency issue. Yes, that is why government had prioritized national road safety issues, and it is doing, everything possible through the National Road Safety Authority to make sure that they are able to execute. But I agree with you. Enforcement is very key. As it stands now, if you look at the major causes of road accident, if I should enumerate it, you will see that most of these some of these causes are avoidable ones. We could have avoided all this. But I mean, people trying to overtake, overspeeding. I mean, impatience of some of these drivers, and sometimes stationary or broken down vehicles, which is very important. And I want to bring this. I want us to bring this discussion on board again. How do we deal with? Because a lot of people have been losing their life as a result of broken down vehicles on the ways. They just go and hit it, crash it, and they die. So at the time when we were looking at how to introduce these towing services, people did not understand. But it is time for us to come back to the drawing board and discuss this matter dispassionately and see how can we resolve. Because now we are using single lane. We have not dualized our roads like those ones we see in Europe and America. It's a long-term let's say, project that we have to do, program that the nation have to do. How do we deal with the current situation that we have single lane on all our major roads? And you see station vehicles, broken down vehicles on the way, and the drivers drive into it. I mean, killing a lot of people. So we need to deal with that matter.
Okay. All right.
Come out, sit down, discuss, national dialogue, find a way. How do we resolve that matter? If we have to get the service of towing trucks to be moving this vehicle on our road as and when they are there so that to reduce the number of accidents, we have to do it.
Okay. All right.
Okay.
Mr. Nyakwase,
yes.
We will have plenty conversations after we all watch the documentary. So for now, I know that you would watch. You are part of the 4 p.m. Viewing, so we will all patiently watch this and have a conversation afterwards. I'm grateful. Ms. Agboja, if you're still with us, I apologize. We've had a lot of interactions in the network, but if you're still with me, maybe just some few words in wrapping up. Well, I'm afraid we lost him there, but we will continue with this conversation, God willing. The documentary Crashed airs at 8 p.m. today, and it is a must-watch for all of us. All of us. This is at the heart of a lot of the things that we do. We've reported on accidents. Sometimes it's unbelievable that a whole bus and buses of human beings will crash and we will lose so many lives. People are being reckless every day, and if there's anything that could speak to us, it is this documentary produced by my colleague Seth Kwame Boateng, and I will entreat that we will all make time to watch it. We will have a lot more conversations on the back of this, God willing, tomorrow. But I'm grateful to all our guests who joined us.